This project is funded by Irish Aid, and Irish Aid is seeking to promote cooperation between higher education institutions in Ireland and universities in the countries which Irish Aid supports, mainly in Africa. Irish Aid's goal is to alleviate poverty, and the aim of the project is to foster and support research and other kinds of activities that will help in various ways to contribute to the ending of poverty or the reduction of poverty in poor countries. Addressing one question, and that is how African governments, how African public administrations are coping with and tackling the HIV/AIDS pandemic, which has been affecting Africa since the 1980s. It's focused on the experiences of 3 countries, South Africa, Uganda and Tanzania, and the project involves a partnership between members of the politics department here in Limerick and our colleagues. The project involves a partnership between members of the politics and psychology departments here at Limerick and our colleagues at 3 universities in Africa: the University of KwaZulu-Natal in South Africa, Makerere University in Uganda, and the University of Dar es Salaam in Tanzania. And we're working with our people in the respective disciplines in those institutions. We're sponsoring PhD work, and different members of faculty are also undertaking collaborative research with each other during the course of the project, which has lasted now for 3 years. But it isn't just a question of producing the kind of conventional academic research products. I mean, obviously, we're trying to publish research which is subject to the normal competitive modes of assessment for quality, so we're publishing in good journals, we're trying to produce a book, that kind of thing. Those are the kinds of conventional outcomes associated with most academic research projects. But we're also trying to make sure that our project reaches the people who are in a position to influence the way that governments behave and the way that people respond to governments. So in the course of this project, we've been talking to people who are active in the communities affected by HIV/AIDS. We've been talking to officials involved in the governments that are trying to tackle HIV/AIDS. We're trying to feed back the insights from our research into those circles, those communities, those networks, which may be able to find those insights useful. Well, I've been working with a colleague at the Centre for Civil Society at the University of KwaZulu-Natal, and we've been looking at a particular group of workers, community health workers, who work around clinics. There are 3,000 or so primary healthcare clinics in South Africa, which are the places where HIV/AIDS patients, people who are HIV positive, every month renew and collect their prescriptions of antiretroviral medication. This is a big program. In South Africa, approximately 3.5 million people are now receiving medication which essentially halts the progress of HIV and prevents it from turning into fully fledged acquired immunity deficiency syndrome. In other words, it's a lifesaver. And the program of treatment is quite a complex one, because it's not just a question of people taking the medication. They require support, they need medical advice, they need testing. You can only take the medicine at a particular stage in the progress of the illness. Once you start taking the medicine, it has to be maintained. There are various side effects that have to be dealt with. So patients require a great deal of support and help during the initial period, at least, of their treatment. And for this purpose, the government has started paying small amounts of money to something in the region of 70,000 or so community-based health workers. And what we did was we interviewed a group of these health workers to find out how the program is working on the ground, to find out if there are problems, to find out if patients are encountering issues that make it difficult for them to maintain their treatment, to discover how efficient the supply of medication is, to find out if patients are encountering problems amongst clinic staff, to find out what the problems are as far as the clinic staff themselves are concerned. In other words, we're concerned really with the relative efficiency, the relative effectiveness of this, what the government calls rollout of treatment on a massive scale. And the insights that we've got are generally rather encouraging. What we've been able to establish is that this program is happening. It's happening fairly effectively, that on the whole, patients enjoy a great deal of support from the community, that the distribution of medication is becoming more efficient, that on the whole, the support that patients get from the community is pretty successful in helping them and encouraging them to maintain their commitment to the treatment. But the other thing, of course, that it demonstrates is that this massive extension of healthcare within the South African population, 3 million patients is a very, very large number, and these are patients for life, does require a great deal of voluntary support, a great deal of public engagement with the health service. And that can't be taken for granted. It needs to be constantly fostered, it needs to be constantly encouraged. What we've learned from this project is what many other researchers have learned from looking at the unfolding of public health care in developing countries. And that is, it's not just a question of getting the medicine, of getting the science right. I mean, medical science can provide us with knowledge about how infections happen and how they can be treated. But people's responses to illness and the way that people cope with illness and the way that they adjust themselves to the various treatment regimes that hospitals, that clinics, that the medical profession, that governments, that public administrations can provide, those things are determined by attitudes, by cultural assumptions, by values and norms. And those values, those norms, that culture, the way that really ordinary life and ordinary interaction, as it were, everyday interaction between people and administration, those things are culturally embedded. And we can't simply take people's reactions for granted. That's what I think we're learning. And so, for example, in the case of HIV/AIDS, for people to be able to commit themselves to a program of treatment, they require education, they need knowledge, they need a deep understanding of the illness. And that understanding is achieved through stages. For a long time, though that's much less the case now, but for a very long time, people who are HIV positive were at the receiving end of a great deal of sort of prejudicial, stigmatized kind of treatment. It was a matter of keeping it secret and not disclosing it publicly. It took a great deal of courage sometimes for people to admit that they had the illness in the first place. Now, attitudes towards people who are HIV positive, those things are also shaped by cultural assumptions, by values and by norms, as well as by public education and how to make public education effective and how to translate it into the values and norms which govern everyday life. That's often very difficult, and that's not something that's just a question of medical science. Universities nowadays have to be outward looking. We're part of an international community of researchers. Academics move around, they move across the world, often very quickly. An increasingly large number of our students are recruited from across the world. And indeed, for universities to survive in countries like Ireland, a larger and larger share of the people that we educate will have to come from outside Ireland. So it's important that we address concerns, issues, research questions, problems that are not simply those that relate to the immediate context, the immediate setting which we find ourselves in here in Limerick. Ireland has one of the most successful programs of overseas development assistance across Europe. It's a program that enjoys an enormous amount of support from the general public. In fact, it's unusual in that respect how much public approval there is for organisations like, for example, Irish Aid, which helps to fund this program. So in many ways, I think the kind of work that we're doing resonates with the community within which we're living.